One of the more challenging decisions we have as a rehab provider is whether to refer someone for imaging when we suspect a fracture. Certainly, we have all the Ottawa rules and the Canadian C-spine rules, and all those things are helpful. But it seems that either there's a body region or a body part that maybe doesn't apply to those rules. Well, if you look at the totality of the research, there are common principles that you can come up with. One, there's a trauma involved that you would suspect a fracture might be there. So you have to have that to kind of enter this realm. The other thing is we frequently see loss of function in the lower extremity, the ability to weight bear and fully weight bear, the ability to use the joint is a big deal and an important factor. The other thing is loss of range of motion in a direction, in a specific direction. If you lose range of motion, that is another factor that says, hey, we probably should get an image. And then finally, bony tenderness. So if we have tenderness to palpation, that can be a really big flag that, hey, we've got something going on. We need to investigate more. One of the things I really learned about this was even dealing with my own kids healing fractures, that yes, we would go in periodically for x-rays and things like that. But when the orthopedic surgeon would palpate and say, okay, how much does this hurt? It was actually correlated with the healing process that we were seeing on the x-ray. If we weren't seeing callus formation, it was still really tender to palpation, really tender to a little bit of a squeeze. As we saw more and more callus formation, that pain went away. When we saw it fully healed, there was zero pain at all. So I think that pain with palpation can be a really profound test. You combine that with loss of function, loss of range of motion, and something that is giving you that suspicion that it is a problem. I think you're a long way to having more certainty of when you should refer for imaging.